Michael, Hannah, thank you very much, and hello everybody. Thank you. As Anna has said, I'm Ruth Crowder. I'm the Chief Allied Health Professions Advisor in Welsh Government, and I'm an occupational therapist by background. My passion is about ensuring that we all deliver the highest quality of interventions and that we work in meaningful ways with people to ensure they can live their best life. I suppose this was brought to my heart really early when I was in school with a very dear friend who happened to have cerebral palsy. And as we finished junior school, she was not able to join us in high school because apparently it was too hard, there were too many places to walk to, too many steps. So she ended up being moved into special education in a way I think wouldn't happen now. But when I met her many years later and compare my opportunities and my career options as opposed to hers, that made me extremely annoyed all over again. So I've actually been asked to talk to you a little bit about my leadership journey. So I'm going to use my career to reflect on what I think is important about advanced practice. I mean, like many of you here, I'm sure, I don't really use the term leader to describe what I do. I just try to deliver the best I possibly can. And I try to describe my vision and get other people to agree with me or change what they do so we can achieve what I think is meaningful change and improvement and thus make that difference to people's lives. But I recognise I achieve far more when what I do is listen and reflect back to people in ways that count to them what my professions and my proposals can do to make things better for them, to meet their needs, and by extension for the people that I'm here to help. If I can get a finance director to see that I can save his budget, reduce demand for his services and create capacity in the system by the organisation using better treatments and AHP expertise more effectively, then hopefully he will secure that more effective use of the AHP on my behalf. And the end point of that is higher quality care and better health outcomes. So I suppose that is leadership. And I would therefore define leadership as having a clear vision of what good looks like, what it is, and how we persuade or work with others to get as close as possible to that vision. A lot of people who I regard as leaders tell me they don't see themselves as that. And I have to ask, what is it about our education, culture, self-confidence, or passion to deliver change that stops us seeing it for what it is? I'm really thrilled to have the job I do now. I provide good professional advice to government to help them deliver the best possible policy and public services that they can. But my advice needs to be robust, reliable, evidence-based, mostly, but it is also professional opinion, based on that triangulation of knowledge, experience, and views of many people around me. I didn't come to this through a particularly straight route, not a traditional health professional career. But when I look back, I can see a logic and belief or value system that takes me right back from my school friend Julie and her experience through to today. And it is a belief in fairness, justice, and ethical working, and my pathway to being the leader that I am today, and my absolute passion to overcome poor practice. As you move into your advancing practice, it is really worth asking yourself, or if you're really brave, asking others around you to tell you what your moral compass is. What do you measure the right action against? I started in the traditional first post-qualifying job at the time, what's now called Hospital Band 5 role, and I was supported by more senior colleagues and amazing team members. I had errors, learning opportunities, successes, and embarrassing failures. I knew I didn't want to work in hospital. I wanted to make a difference as an OT to how people were able to do what mattered to them and live their own lives in their own communities. And I saw the place to do that as community services. So I worked in social care, which gave me an enormously eclectic range of experience. All the world is there and all the complexity and challenge. And I saw real barriers to people we work with becoming independent. Some of those were from other professionals, petty rules, poor practice, a lack of challenge and expectation, and a tolerance for poor practice that limited people's ability to live really well. Oh, don't get me wrong, I also saw amazing work, creative care, scientific development, innovation, and strong leadership. And I then went into higher education, which I loved, developing the best possible education. The next best generation for our profession was absolutely wonderful. Stimulating them to always question, improve, and strive to be the best they could was inspirational. And I think there's something very important in our role as leaders and advanced professionals in how we enhance and facilitate growth in our colleagues, both students and team members, our support staff and our juniors. Because we also have the power to crush, destroy, and inhibit, to limit vision. We can choose to enable learning and change, or we can mould in our worst selves, and I know which I prefer. And this is also where I saw how challenging it can be for practitioners to engage in research. How rarely our students see any of us actually engaging in research, or how rarely we implement the new evidence, thinking, and techniques we might read about. I have a real struggle with the unwarranted variation in our services, how power, control, empire building, just plain lack of vision maybe, stop people changing what they are doing in the light of new knowledge. Sometimes because it's easier not to. Sometimes because it's just, that was developed elsewhere, couldn't possibly work here. Some of our variation is just unjustifiable, and for me, morally very challenging. This year in Wales, myself and our chief nurse have commissioned an action plan for building research capacity and careers for nurses, midwives and AHPs. The priority project seeks to evidence and present the actions we need to take to enhance how we expand our research capability, to ensure every practitioner can read and understand new research and evidence, but also to understand what actions we need to take to build real research careers in our professions. There is a real challenge with finding and creating and supporting the opportunities for people to move out of practice into research, or for people to be able to build that into a practice role is extremely challenging. One of the biggest findings has been that the culture of our organisations and people make you question how much we actually value research and quality, or if in fact that hamster wheel and pressure to just see patients at any cost is actively inhibiting good quality care. As advanced practitioners or aspiring advanced practitioners, or as educators and leaders seeking to advance practice, you may have seen the same. We happily talk about the 4 pillars of advanced practice, but the pressure to just do the job, just do clinical, see patients, or manage operationally rather than lead and improve is enormous. And I think being an advanced member of a profession places a duty and responsibility on us to change that, to seek only the best and to deliver that. And we cannot do that, I believe, unless we educate and enable development in others. We share our knowledge, learning and experience. We must use and create research evidence to advance each of our profession's knowledge, to enable us to understand what is effective and what is not any longer, and to use that in our daily practice, to model our expertise for others and create the environment that allows, if not in fact actively encourages, the challenge of poor practice and the growth of the best. But all of that is a total waste of time if we do not articulate to others how we can help and how we should be used. And my next role took me to working as a lobbyist for my professional body. Now, some of you may cringe when I use that word. You can dress it up as a policy officer or public affairs officer if it makes you happy. But the function I undertook was to lobby politicians, civil servants, officials, government service leaders and the media to drive a better understanding of what good health is, what good health practice is, and why it is in their interest to use our skills to best effect. And although that was my main job role, I placed that strongly in the education pillar of advancing practice, because I believe unless we explain what we do, why we do it, and what difference it makes to the people around us, we have to ask, why would anyone employ us? Why should public money fund us? So if we are to make the best possible lives for our patients, clients, our population, then we must be able to explain our practice clearly. And that's what led me to my current role, doing just that, helping our amazing civil service to understand how health and care work, what allied health professionals bring that is different to the more traditional long-standing professions that everyone knows about, but also to drive the change we need to have to meet our population's needs today and tomorrow, not back in 1948, when healthcare needs and population communities were totally different. And I hope from what I have said that you can see why I am fully supportive of our regulator's position in terms of what advanced practice is. The Health and Care Professions Council is very clear that they already regulate advanced practice, always have done, because each of us is required to demonstrate how we deliver according to our role and current scope of practice. Myself and my 3 fellow Chief Allied Health Profession Officer colleagues in the other 3 nations of the UK intend to make a position statement on this as well. I don't believe that advanced practice is a list of tasks borrowed from others or taken into your professional scope to widen it, and that's what makes you more advanced than your colleagues who don't inject, prescribe, or whatever other task is identified. For me, advanced practice is about advancing the knowledge, evidence, expertise and delivery of our own practice. It is about being able to manage the most complex care needs carefully, safely, with the best possible outcome for the person, in the way that a less experienced person, or even an advanced practitioner 10 years ago, might not have been able to do. It is about advancing our practice as we practice, noting and learning from new actions and experiences, systematically recording and reflecting on new ways of working, and then by ensuring through all those 4 pillars of advanced practice that you evaluate, educate and share that new learning so the whole profession advances and what every single one of us does is the best we possibly can. Don't please allow yourselves to be boxed into considering yourselves advanced because your scope or role is clinically different. We only advance practice by learning, teaching others, researching, enabling change, driving improvement robustly, safely, and with real evidence behind us, so that those who come after are doing today's advanced practice from the day one of their professional lives. I'm passionate about making a difference, about us building and growing our professions so that our people, our family, our friends, our fellow citizens live healthier, longer lives, knowing the care that they received is cutting ahead through the grunge that can sometimes stifle innovation, and that they are on the receiving end of professional care that seeks always to do better than yesterday's colleagues. I know, and I'm sure you will have an amazing rest of the day. Thank you so much for allowing me to speak to you. I've really enjoyed looking back at my journey and maybe starting to recognise how, where and why I lead, and I hope that you will do the same after today. Diolch yn fawr iawn.